Africa as continent provides great opportunity for growth because economically it had lagged behind, and health wise also lot of parameters need improvement, be it lack of vaccine, be it problems of nutrition. Africa had struggled, but it is high time the professionals from public health now take over the reins and provide the best of services in African continent. I'm Dr. Pranav, HOD Department of Public Health, and I tell you what's the present requirement for public health professionals in Africa. Right now, the maternal health condition in Africa is not so good. Mothers are dying, and so is the condition about malaria, tuberculosis, and HIV. Now, considering this and added on this, there is a unique situation where malnutrition and vaccination challenges are still prevalent. The vaccination coverage is still lagging behind as compared to other countries across the globe in the continent of Africa. Now, considering this, public health professionals are hugely sought after. All the international big agencies, including World Health Organization, Gates and Melinda Gates Foundation, UNICEF, everyone is there and working really hard. But considering the importance of terrain, which is really tough, and the diversity of language, we need people who belong to Africa and who can really work hard understanding the local languages and braving the local terrain. That's why we have opened door here at GD Goenka University for the students coming from South Africa, Gambia, Ghana, Nigeria, and all the students are coming and they are really keen and passionate. Some of the students you can watch in our other videos. They are working really very keen way in our anemia programs, infectious disease programs, and their enthusiasm is infectious. The way they are participating, because they have got a keen observation sense, and now they are so hardworking. They have got a passion for the improvement in the health conditions in Africa, and so they are working really hard. And if you are doing graduation in public health in India, there is a huge advantage because India still is a developing country. So there is lot of similarities. So there is lot of similarity in terms of systems, in terms of infectious condition, in terms of people who are economically disadvantaged. So as compared to going to developed nations like Britain, like going to America or European nations or even Australia, we have got a huge advantage because the exposure to the Indian system is one of the best in infectious diseases, maternal diseases, and diseases related with malnutrition. Such kind of exposure you cannot really get in US. Now, if I talk about, say, tuberculosis, so in India you can still see all the program being run at ground level, the screening programs, drug distribution program. Now such huge infrastructure for TB doesn't exist even in United States or say about Britain or Australia, anywhere else. So that way, if students from Africa, they want to go abroad outside of Africa to study public health, India offers best program. Like as I said, at GD Goenka University, with our collaboration with national and international systems of infectious disease like tuberculosis, measles outbreak studies, our collaboration with malaria program, it provides huge insight. So students right from the day of graduating, they are ready to take over the reins. They are ready to implement the program in their native countries. And that's why our public health students from GD Goenka University, they are really sought after in Africa. Some of them are at really high position and leadership role. So I welcome all of you. If you have got any doubt, if you have got any questions, you can just drop a mail or drop your queries on the comment below. We'll be more than happy to answer your questions. Thank you all.